Insulin resistance is a major factor in many chronic diseases, including what this channel is devoted to, type 2 diabetes and prediabetes. The main driver of insulin resistance is, of course, hyperinsulinemia, or high levels of insulin in the body. This issue doesn't only lead to diabetes, it's also linked to obesity, hypertension, cardiovascular disease, cancer, metabolic syndrome, atherosclerosis, Alzheimer's disease, and the list goes on. Hyperinsulinemia and insulin resistance are a major problem for long-term health, and another big problem with this picture is that most people don't even know they have them. In this video, I'll share with you how you can identify whether or not you have insulin resistance. If you don't know what insulin resistance is, I have a short video that explains it, so I'll make sure that's linked below. First, let's talk about physical signs, things that you can actually see happening with your body that are associated with insulin resistance. First up, skin tags. These soft fibromas, or little outgrowths on the skin, are a benign skin condition that are associated with insulin resistance. Insulin is a growth-promoting hormone, which stimulates another hormone called insulin-like growth factor 1 that binds to receptors in the outermost layers of the skin, triggering increased growth rates that result in the formation of skin tags. Another telltale sign of insulin resistance is areas of velvety darkened skin that most often occur around the neck, groin, and armpits. The medical term for this is Acanthosis nigricans. Hair abnormalities can be an indicator of insulin resistance, specifically androgenetic alopecia and hirsutism. Androgenetic alopecia is a pattern of hair thinning that's associated with androgen hormones. Androgens are sex hormones associated with male characteristics, although women also produce these hormones. Testosterone is the primary androgen hormone. This type of hair thinning actually affects men and women at a similar rate. Typically, the way this presents in men is with thinning of the temporal areas of the frontal scalp, which is the sides of the front hairline, and then they begin to lose hair on the top of the head. In women, the hair loss is a little bit more diffuse, but most of the thinning is concentrated on the crown of the scalp, and they tend to keep their front hairline. Hirsutism is excess body hair in a male pattern in women, which includes increased hair growth on the chin, the upper lip, the lower abdomen, and down the midline of the abdomen. Abdominal obesity is associated with insulin resistance. Obesity concentrated in the abdominal region is due to an increase in fat around the organs. This type of fat is particularly detrimental and comes with an increased risk of many chronic diseases, including diabetes, cardiovascular disease, and cancer. Waist circumference is often used as an indirect measure of abdominal obesity. A waist circumference greater than 40 inches for men and 35 inches for women are indicative of abdominal obesity, which again is associated with insulin resistance. Hypertension, which is high blood pressure, and even prehypertension, which is borderline high blood pressure, is another potential sign of insulin resistance. While you can't physically see this on yourself, blood pressure is routinely tested at your visits with your healthcare provider. Normal blood pressure is less than 120 over 80 millimeters of mercury, so essentially everything over that would fall into the category of either prehypertension or hypertension and would be a potential indication of insulin resistance. Now, let's get into a few symptoms of insulin resistance. The severity of symptoms can vary depending on how long the insulin resistance has been present. If it's just starting, you may not notice major symptoms, but as it progresses, remember this is a precursor to prediabetes and type 2 diabetes. So essentially anyone with those conditions has insulin resistance. But prior to blood sugar levels rising to the point of being able to diagnose either prediabetes or diabetes, there are symptoms associated with insulin resistance, although the connection is often not made. I'd like to share two symptoms in particular to be aware of. First, intense cravings, especially for sweets, can be an indication of insulin resistance. Secondly, reactive hypoglycemia can be an indication of insulin resistance. So what is reactive hypoglycemia? Hypoglycemia means low blood sugar. So it's basically a blood sugar crash that often happens a few hours after eating. So it essentially happens shortly after a blood sugar spike. And it comes with a collection of symptoms. What are the symptoms of reactive hypoglycemia? Well, symptoms include fatigue, headaches, hunger, irritability, and by the way, the combination of hunger and irritability we've come to know as feeling hangry is a symptom of reactive hypoglycemia, as is anxiety, tachycardia, which is a rapid heart rate, confusion, brain fog, weakness, feeling lightheaded or dizzy, nausea, and even more severe symptoms like impaired vision, decreased coordination, and seizures are associated with low blood sugar. But essentially, if you're not feeling well a few hours after eating, or if you feel like you need to eat every few hours to avoid feeling yucky, that may be an indication of insulin resistance. Before I get into the lab tests and measurements for detecting insulin resistance with hard data, I just want to say if you're finding this information valuable, leave a comment below and let me know. I'd love to hear from you. And if you haven't already, make sure to subscribe to my channel and hit the thumbs up button so I know you're enjoying the content. Okay, now let's talk about data. The tricky thing about testing for insulin resistance is that the tests they use for insulin resistance in a research setting aren't widely used in clinical practice. There's no simple insulin resistance test, so to speak, but there are lab tests and measurements that we can use to detect the presence or risk of insulin resistance. The first is simply a fasting insulin test. While checking your insulin levels aren't telling you about the cellular response to insulin, meaning we don't really know from a fasting insulin level if the cells are resistant to the insulin signal, but we do know that hyperinsulinemia is a requirement for the development of insulin resistance. So if we have an elevated level of fasting insulin, it's a pretty good sign that there's a problem here. And by the way, insulin levels rise far before blood glucose or blood sugar levels start to rise with prediabetes or diabetes. So testing insulin can help catch metabolic dysfunction early before it progresses into these more advanced conditions. A normal fasting insulin level is technically considered less than 15 microinternational units per milliliter, but many functional medicine physicians believe that numbers between 2 to 5 microinternational units per milliliter are better indications of an optimal fasting insulin level, and that numbers above this indicate the potential development of metabolic dysfunction like insulin resistance. Just a side note, this is often not a routine test, so it might be a test that you want to ask your doctor to run if you have reason to believe that you might have insulin resistance. Next, I want to talk about using fasting blood glucose and hemoglobin A1c information to detect trends that may indicate insulin resistance is developing. Fasting blood glucose and hemoglobin A1c are routine tests to determine if your blood sugar levels are normal or not. If they're elevated, that's an indication you have either prediabetes or diabetes. The issue with this as it relates to insulin resistance, of course, is that by the time blood sugar levels are elevated, you will have had insulin resistance for quite some time. So these two aren't the best tests to detect insulin resistance, but most people have historical data going back several years. You may have access to your blood sugar levels for the past 3 years, for example. So you might be able to look at the trends in your numbers to detect whether an issue is developing. For example, let's say your blood glucose level 1 year is 87, then the next year it's 92, and the next year it's 97. Those are all technically normal numbers. A blood glucose level of less than 100 milligrams per deciliter is considered normal, but the numbers are trending upwards. So that can be a helpful cue that insulin resistance may be developing, and it's worth running other tests, like a fasting insulin test, for example. So while glucose and hemoglobin A1c aren't direct measurements, looking at their trends can help. Another routine blood test is a lipid panel, which has two valuable pieces of information that can give us clues about insulin resistance: the triglyceride levels and the HDL cholesterol levels. When there's too much glucose for the body to use or store, insulin signals the liver to convert the excess glucose into triglycerides. So elevated triglyceride levels can clue us into our body's insulin and glucose situation. Insulin resistance is associated with elevated triglycerides and low HDL cholesterol levels. As a side note, your HDL cholesterol you'll often hear referred to as your good cholesterol, so higher numbers are typically better. The triglyceride to HDL ratio is a way you can measure your risk of insulin resistance. Just take your triglycerides in milligrams per deciliter and divide by your HDL cholesterol in milligrams per deciliter. A number of 3 or higher is associated with insulin resistance. A number of 2 indicates low risk, and a number of 1 or lower is considered optimal. The triglyceride glucose index is another way to use your routine lab testing data to measure for the presence of insulin resistance. This index is calculated by multiplying fasting triglycerides in milligrams per deciliter by fasting glucose in milligrams per deciliter and dividing by 2. A number of 4.5 and above is associated with insulin resistance. Insulin resistance can be a little bit tricky to identify, but I hope this video has you feeling more confident in knowing how to determine if it's a factor in your life. My friend, if you found this video helpful, do me a favor and share this video with a friend that you think could benefit. The only way we can get out of this metabolic mess that we're in and prevent levels of diabetes from rising even higher than they already are is to stop it from developing. And we do that by identifying insulin resistance first. With healthy lifestyle principles, we can change this insulin resistance picture. As always, I hope you found this video valuable and thank you for being here. Take care, friends. I'll see you next time.